My dear distinguished scholars and students, good morning and good afternoon. First of all, thank you very much for organizing committee to invite me to attend this and presenting at this conference on health sciences, the strategies for optimizing community well-being during the COVID-19 pandemic. And I'm Tuyen. I'm now the assistant professor of Taipei Medical University and also the vice president of Asian Health Literacy Association. And today I would like to share with you a topic related to improving health behavior during and after the COVID-19 pandemics. This is one project that I would like to share with you, and we conducted this in 2020 and 2021 with 10 components, and one of those is a lifestyle that we discussed today, and the role of health and related behavior in managing the COVID-19 pandemics. And if you'd like to read more about our publication, please scan the QR code here, and you can access to the published articles. There's about 15 articles published over here. And today I would like to emphasize about the role of the health-related behavior in managing COVID-19 pandemics. It could be indirect, right, to improve people's health, then further control the pandemics. So I would like to share about 5 of our publication. The first one is about the impact of health-related behavior on the depression, anxiety, and health-related quality of life among the healthcare workers. The second one is about healthy eating behavior on fear, and also the changes in mental health and quality of life among the healthcare workers. We emphasize healthcare workers first because they play a very important role in controlling and also managing the pandemic. And the next 3 paper is about outpatient, and we emphasize the health-related behavior, modifying the association between the underlying health condition and also the mental health, and also modify the negative effect of the COVID-19 lockdown on depression. And also we investigate the single and combinative impact of healthy eating behavior and also physical activities on COVID-19 like symptoms among the outpatient. The first paper we published in the BMJ Open with the title of the Impact and Interactions of the COVID-19 Response Involvement, Health-Related Behavior, Health Literacy on Anxiety, Depression, and also Quality of Life amongst the healthcare workers. So this study was conducted in April 2020, based on online and so self-administered questionnaires in 19 hospitals and health centers in Vietnam, and we collected about more than 7,000 healthcare workers. For detail about the research method, I refer you to read the full publication. This is just summarize the finding that we have. The first one, you see that healthcare worker who involved in response to the COVID-19 has 4 times higher likelihood of the anxiety and depressions, and also related to lower score of the health-related quality of life. However, if they have healthy eating behavior and also physical activities, these risks of having, I could say they say not the risk, but actually they show the positive impact on the anxiety and depressions, and also higher score of quality of life. For those exposed to smoking and alcohol, they had higher risk of a higher odds of anxiety and depressions. Right, and we also checked their interaction for those involved in response to COVID-19 pandemic and have healthy eating behavior. They likely to have lower odds of anxiety and depression, higher score of health quality of life. But those, over here we also found unexpected result that smoking and drinking also interact with COVID-19 response involvement, and this kind of the adaptive behavior, which is not good for the long term. Right? And physical activity good, showed positive interaction with the COVID-19 response and associated with lower order of anxiety and depression, and also high score of health-related quality of life. So to conclude about this paper finding, healthcare workers involved in the healthcare interaction in other departments or health facility involved with the COVID-19 pandemics had higher risk, higher likelihood of anxiety, depression, and lower health-related quality of life. And healthy eating, physical activities are associated with lower likelihood of anxiety, depression, and also higher score of quality of life. Smoking and drinking were associated with poor mental health and health-related quality of life. For physical activities appear to protect mental health and health-related quality of life in response involve healthcare workers, but drinking were harmful to health-related quality of life. Unexpectedly, smoking and drinking also were negatively associated with response involved healthcare worker mental health. For the long-term effect of the lifestyle need to be investigated in future study. So very quick we published these papers to provide the evidence for government and organization strategizing to protect healthcare workers' mental health and quality of life during and after the pandemic. Right. So the next paper is we also analyze in the health-related behavior and also in healthcare workers. So this one is we emphasize in fear and change of mental health and quality of life. So we analyze the online using the online survey and the online samples in 15 hospital and health center in April 2020, and we analyze only for more than 2,000 frontline healthcare workers. So very brief, these are the key findings of our study. So if the people with high score of the healthy eating behavior, then they have lower score of fear and also more stable and better mental health and also health-related quality of life. So that is about healthcare workers, that we need to improve their physical activity and also healthy eating behavior in order to improve their mental health and quality of life, which further, they can have to protect people and public. Right, now move to the patient, our patients. So this is another findings related to the modification impact of health-related quality of life, health-related behavior on the association between underlying health conditions and also mental health. So this is a cross-section study we conducted on more than 8,000 outpatients in 18 hospital and health centers across Vietnam from February to May. Then we collected different variables, different factors, and analyzed. So this is the outcome that we found that people with the underlying health condition, they have higher likelihood of having depression and anxiety. And also same with those who have suspected COVID-19 symptoms, they have also 2 to 4 even higher likelihood of having depression and also anxiety. Fortunately, physical activity and healthy eating behavior show the protective effect impact on people's mental health. Right, and we also check the interactions between the variables, and this is interaction between underlying health condition and also suspected COVID-19 symptom. They make the mental health getting worse. However, we adjust for people with a healthy behavior such as exercising and also healthy eating, then the protective impact significantly protect people mental health. All right, and we also check another behavior, right? It's about a preventive behavior. So this preventive behavior also have to protect people, especially with the underlying health conditions. All right. So this conclusion just repeat what I just mentioned in the results. I'll skip this and move to the next paper. So the next paper is about healthy eating behavior potentially modifies the negative impacts of COVID-19 lockdown on the depressions. And this we also using the same samples analyze these associations. We found that the people during the lockdown and with lowest right healthy eating score, then they have like higher likelihood of depression. But if they have better healthy eating behavior, then they have lower likelihood of depression. So it means healthy eating behavior positively interact to protect people from depression during the lockdown. Right, so this is just to summarize what we found. So usually lockdown is a necessary measures. Right? Everyone agree that lockdown is important measure to contain the pandemics. So it's also, on the other hand, show the negative impact on the eating behavior and also mental health. Fortunately, healthy eating can protect people's psychological health during the pandemics, especially during the lockdown period. So strategic public health approaches are required to develop the nutritional support program or some others, healthy or lifestyle intervention program in order to improve the healthy eating behavior and also lifestyle, which can improve people's mental health and also respond to the pandemic. Right, and we also analyze to see whether healthy eating and also physical activities have any combinative impact on suspected COVID-19 symptoms among our patients. We all know that healthy eating is good, physical activity good to protect people from getting infectious, or at least to prevent the severe conditions. But in this paper, we further examine the combinative impact. We're using the samples in the first part of the survey. We have assessed the physical activity score using the IPAQ questionnaires. So we have sampled about almost 4,000 patients and analyzed all the variables related in this title. So the results showing that if people consume more vegetables, fruit, fish during the COVID-19, then during COVID-19 pandemics, then they have lower likelihood of having symptoms like COVID-19. And overall score of the healthy eating behavior also shows the protective effect, right? The protective impact, and also physical activity for the actively doing exercise or physical activities, then they have also lower likelihood of having symptoms like COVID-19. And we examine the interaction between physical activity and healthy eating score, and we found that these two factors also combine jointly to reduce or to lower the symptom like COVID-19 symptom. Right, so we also conclude that it's very important to using both physical activities and also healthy eating behavior to protect people from having this suspected COVID-19 symptom. And of course, healthy behavior should be promoted to improve people's health and well-being and further contribute to control the pandemic. Alright, so that is some of our finding from the research projects. And now if you ask how to maintain the healthy lifestyle and to improve our health and also in order to control the pandemics now and later on. So I just present here the finding or the publish of the American Heart Association relate to 7 simple life, very easy, right? To manage to improve our lifestyle and to control even to prevent the chronic conditions, and of course for managing the COVID-19 pandemic. So the first one is about the manage blood pressures, control the cholesterol, reduce the blood sugars, eating better, losing weight, getting active, and stop smoking. Right, so this is every simple action that we should do every day, and we for not every day for blood pressures or cholesterol, but you need to go to hospital to check them and follow the suggestion from the doctors. Right, and another new concept is about the lifestyle medicines. So this is proposed by the American College of Lifestyle Medicines, which they just published last year. So this including 6 part of the lifestyle medicine. The first one is about increase the physical activity and also healthfully eating, right, of whole and plant-based food. Develop strategies for managing stress, form and maintain the relationship, improve your sleep, and also stop smoking. Right? Some similar with the previous one, but they elaborate more about the psychological health part, right, and also sleep. Right, so now this is another model to improve our physical activities. So this is a proposed 4 domains, including the households, recreation, transportation, occupation, and school. So these 4 areas that we need to improve to create the better environment for people to have better physical activities, right? And also of course society and also some other higher level of the environmental characteristics that we have to focus on, and also the policy is also very important to provide a better environment. So when you may ask like, oh yeah, this is good, but single one cannot do it, right? Ministry of Health alone cannot do that, and we need to work with many other sectors to provide these comprehensive models. And the question is, how do the stakeholders come together and amplify health behavior or healthy lifestyle efforts? This is the headache question, but they also figure out some of a proposal that over here there's a healthy living for the pandemic event protection. They have a group to set up, and they're using these models as a reference for different system and country to refer to. Right, so let's go with the first one. It's about professional organizations. So this organization have to advocate and champions the healthy lifestyle through leaders, the stimulation, scientific knowledge, and also practice guideline, and also the professional meeting to do so. For the government organization, should create, support, and implement the legislations and programs that support healthy lifestyle initiative to the population level. For the NGOs, should advocate, create, support, and implement healthy lifestyle initiative. And for insurance industry, should provide a mechanism for coverage of healthy lifestyle initiative. And for media outlets, this should disseminate the credible healthy lifestyle information to the lay public. And for the education system, should provide an appropriate healthy lifestyle curriculum at all levels of education and create a healthy lifestyle environment within the educational setting. And for employers, should create a healthy lifestyle environment within the workplace and offer healthy lifestyle program to employee. And for health fitness industries, right, which is growing in many countries, so this should provide infrastructures and professional capables of offering healthy lifestyle programming to the public. For healthcare organization, you see, healthcare organization is one of the players in this comprehensive model. So healthcare organizations should integrate healthy lifestyle intervention into the medical models as a standard of care, right, and work with the insurance, right, and to change the mechanisms how to cover those initiatives and many other sectors, right. Now the next one is about mobile health and technology companies should bridge technology intervention or advances that support healthy lifestyle initiative to the market. And finally, food industries, making healthy food choices available and provide health conscious nutrition labeling. Right? So you may question, like, okay, after we provide all of this very good, very convenient environment, whether people can improve their lifestyle or not. Question that is easy, but the answer is very difficult, because we need to change the consumer behavior, which is people, right? Which is public, the general public. How they can change their behavior and use those services we provide, right? And that is the comprehensive models. So all of this we need to put into actions, and university, hospital, health system, and many other sectors, we have to work together. All right, so with that, I would like to thank you again for organizing committee and all of you, scholars and students, to listen to my presentations. And I'm the associate editor and so guest editor of the 2 special issues on the International Journal of Environmental Health and Public Health related to a healthy lifestyle for preventing the NCDs. And also another one is about health, dietary intake and eating behavior and health outcome. This is on the frontier of nutrition. So those are on the Q1 journal. So please submit your research finding to these 2 special issues if you have related work, and keep in touch. Right, so if you have any questions, please email me or send the question to the organizing committee, then I will get back to you as soon as possible. Right, so have a great day and great success for the conference. Thank you. Bye-bye.